Trauma is injury caused to living tissue by an outside force. The most common type of trauma in archaeological context are fractures and dislocations. The types and patterns of trauma in a population reveals things such as subsistence economy, occupation, interpersonal violence, living environment, and medical practices. While fractures involve the skeleton, keep in mind the underlying soft tissues would have been damaged in life, which would have compromised movement or function. When we look at a skeleton for trauma analysis, there are several questions we have to ask. The first question is, did the trauma happen around the time of death? Any trauma that occurred at the time of death provides clues to what was the cause and manner of death. We also look at trauma before death, any trauma that has happened in that person's lifetime. You can also look at damage to the skeleton after death, but this is not of real importance to the analysis. You also look at the force that caused the trauma. So if it was a weapon, then you need the size, the construction, and the shape. We're also looking at the number of wounds, because this helps to determine the manner of death. If there are multiple sequences of wounds or multiple traumas, then we need to figure out which ones happened first and then which ones happened after that. The other things we're going to look at are also the position of the attacker, the determination of the sex of the attacker, the height of the attacker, and the handedness. So, there are some basics of bone trauma. You can have a simple fracture, which is a discontinuity in a bone that breaks into two pieces. The most common cause of a simple fracture is a fall. Another type of fracture is a comminuted fracture. That's a break that results in multiple fragments of bone. These often happen in either violent homicides, suicides, either traveling at high speed, falling at a great height, or accidents. The third type, which is also very serious, is an opened or compound fracture. This is when the bone has actually broken through the skin. Another thing we look at are what are called fracture lines. Fracture lines are going to originate at the point of impact and spread the force of the trauma through the bone. One type of fracture line are called radiating lines. These are the most common fracture lines, and they spread outward like a starburst from the applied area of force. Where all the lines intersect, or the center of the lines, is usually the place of impact. Another type of fracture are called hoop fractures, and that's where rings form around the area of a high velocity impact. The surface of the bone bends in during the impact and then pops back out. These usually don't cross other fracture lines or suture lines. So when the force hits a pre-existing fracture or suture, the actual original fracture line or the suture line actually dissipates or lessens the force. Sometimes you're also going to see fracture lines on the opposite side of the skull from the original force. So when you look at this skull and you're looking at their frontal, you can see where the impact was on the side of the head and the fracture lines actually traveled across the frontal. And then on the back of a different skull, actually, you can see all of these round impacts where you see hoop fracture lines where the original velocity was very high, whatever hit their head was fairly round, and you can see where the actual bone just punches in. So we also need to look at how fractures heal. So there are actually 4 major stages to fracture healing. So once you have a fracture to the bone, the broken blood vessels and veins are going to send clotting factor to stop the bleeding. So usually a little bit of bleeding is good because it will clean out any bacteria or dirt or particles that may cause infection. So once the clotting factor arrives at the site of the break, it's going to form a huge blood clot, which is called a hematoma. This coagulated blood actually helps to stabilize the two ends of the bone. The second step is where the periosteum, which is the fibrous tissue layer around living bone, is stimulated to generate new bone formation. So the first thing that happens is a fibrocartilaginous callus, so connective tissue, is going to span the break and try to stabilize it some more. So the third stage is when a bony callus of woven bone is laid down. So remember, woven bone is done in a haphazard manner as quickly as possible. So it's mineralized, so that means it has a fairly rigid structure, but it's not going to be as strong as mature compact bone. So the primary callus is going to form at about 6 weeks. So you can see why it's important to immobilize the ends of a bone during a fracture. The last stage is when that woven bone is going to be replaced by regular layers of compact mature bone. So remember, compact mature bone is going to be a lot stronger than the woven bone, and this is going to provide a callus. So again, it's going to look like a little bump, and then over time, the bone remodeling cells are going to remove the callus and smooth out the bone. So if a bone is set very well, and especially in children, in X-ray, it may be almost impossible to detect there ever was a broken bone. So the timing of the healing. So while there is a certain sort of path or way bone heals, how long it actually takes depends on a lot of things. So one of the first things that it matters is which bone. So a smaller bone that isn't a weight-bearing bone, of course, will probably heal faster than either a weight-bearing bone or a bone that is hard to set. The second thing is the severity of the fracture. So if it's a clean fracture, then hopefully things will go fairly quickly. But if it isn't, if it's a comminuted fracture, which essentially means there's many little pieces, or a compact fracture where it splits the skin open, you're going to have complication. Another thing is positioning of the ends. So this is why it's important that the ends of the bone line up and are straight. If they are not straight, if they are off, then there's a chance the bones are going to actually either mend crooked or mend rotated. The fourth thing is the stability of the ends. You need the ends to not move. So it's very, very important to try to immobilize the ends of the bones as much as possible, because every time you accidentally move the ends of the bone, it actually rips everything apart and the healing process has to start again. Another thing is, of course, the nutritional state of the individual, because you need a lot of vitamins and minerals in your diet in order to have the extra vitamins and minerals needed to reform bone and also fight any infection and also help the whole body heal at this point. And the last thing is the age of the individual. So, of course, the younger the individual, because they're also growing, the faster they are going to heal. The older an individual is, the slower the bones are going to mend together and the slower it's going to heal. That's why if a baby falls, it's usually not that big of a deal. If an elderly person falls, it often is a very, very big deal. So next we're going to talk about what happens when things go wrong. So for instance, in this skull, you can see all of the front teeth have been knocked out. So obviously something went very wrong. There are signs of other fractures around the face. So this was not ideal for this person. So we're going to see what else can happen. The most serious complication is infection. So usually this happens when the skin, the muscles are penetrated by the ends of the bone. Usually whatever caused the break in the bone can introduce pathogens into the body. So another time where it's very serious, if any bone penetrates any of the digestive tract. So your digestive tract is also filled with bacteria. It helps you to digest things, but if they're not contained within the body, they can actually end up killing you. So compound fractures are the ones that are most commonly cited when you see a bone infection, because it actually has broken the skin, allowing other things to enter the body that normally are kept out. One of the most deadly kinds of infections are also, for some reason, for instance, is gangrene, which actually causes tissue death where the skin and muscles actually turn black. And usually in the past, the only treatment for that was amputation. So, of course, one of the things that happens when you have an infection is it forms pus. So pus is essentially the white blood cells that have captured the dead bacteria and killed it and are trying to push it out of the body. The problem is that this pus, if it's not expelled by the body correctly, can actually travel through the bloodstream and infect other parts of the body, and this is called septicemia. In pre-antibiotic times, death from septicemia could occur in almost 40% of all fracture patients. So when you're looking at this picture, you see a bunch of femurs that have been broken that have all healed kind of crooked. So in the second and third one from the bottom, you can see that there are holes and divots, and you can see where everything either healed crookedly or actually healed overlapped. So they were not able to sort of immobilize the bone correctly. And all those holes you see, there was probably pus draining out of them. So another thing that can happen is when there's a disruption to the blood supply, and that leads to tissue death. The dead piece of bone can become isolated, and this is called a sequestrum. If the periosteum is still intact, it will create a sheath of bone around the dead area, and that is called an involucrum. So another way that there's a problem is if the break occurs along the epiphysis of children's bones. This will cause premature fusion and shortening of the whole bone and actually disrupt their growth. If, unfortunately, the nerves are also damaged, this can cause paralysis. If there is paralysis, then the muscle and the bone will start to atrophy and waste away because of no use. So if you look at this, these are femurs, so the left and right femur. So you see shortening of one femur, and then you can see how very, very skinny, and there's no muscle attachment. So this person definitely could not walk around, and therefore they are essentially paralyzed and wasting away. So another problem is that the ends were not immobilized. So healing can be delayed or incomplete if the ends of the bone can't be adequately immobilized. Either they didn't have medical treatment, the medical treatment was not very good, or it may be certain bones in the body that are actually very difficult to keep still. So what happens is that bony callus never fully mineralizes because it keeps breaking and resetting and breaking and resetting. So this can cause what's called angulation, where the angle of the bone is wrong, or it can also cause rotation, where the pieces twist and then are healed incorrectly. And in the most serious, it causes what's called non-union, where the two pieces actually never mend, and it causes a new joint, and it's called a pseudoarthrosis, which means it's not a real joint, it's a fake joint. So in this picture, you can see a clavicle that has healed completely, but it's in two pieces. So the clavicle actually is very hard to immobilize because it's one of those bones that actually moves around while you walk and also while you breathe. So another thing that can happen is called traumatic arthritis. So if your joint surface is actually broken, that will damage the cartilage at the joint and also the underlying bone. Because cartilage doesn't have its own blood supply, it's usually very slow to repair itself, and often it can't completely repair itself. For instance, a lot of football players damage their knees, and they actually have to have cartilage replacement surgery because the cartilage itself will not heal. If there's a change in the angle of the bone or the bone is shortened, this can also cause traumatic arthritis because the biomechanics of the joint have been changed. So in this picture, I know it's hard to see, but this is actually the end of the tibia and one of the bones of your ankle. And you can see that the whole joint has been destroyed, and there is also remodeling, and it's actually changed the shape of the joint, and it probably would have been very painful to move. And then finally, another thing that can happen is joint fusion. If it is a compression fracture or another fracture, usually where a lot of force crushes the joints together or crushes the space between, for instance, two vertebrae, what you can see in the end is as it heals, those two or more bones simply fuse together. And again, that is an immovable joint. So what you see here is the same bones as the last slide, where you see the end of the tibia and the top of the talus, and you can see the normal one on the right and then the two in the middle on the left where they've actually rotated and fused together, therefore making it almost impossible for this person to move their foot, and then of course that would have changed the way they walk.